basically we should be commenting on, we can comment on ocular discharge, unilateral, bilateral, nasal discharge, unilateral, bilateral. You can get an idea of face shape, face symmetry, ear carriage, whole face symmetry, whole body symmetry, how it is responding to the environment, how it is responding to us. Is that what we expect it to do, or is that different to how we would expect it to behave? That's also less so in sheep, more so in cattle, whether it is going to be safe for us to approach that animal, and whether it's safe for that animal for us to approach, or whether it's going to try and do run into the wall, jump out of the pen. You're assessing how basically you're going to get beside it and restrain it in a safe way so you can examine it.
One also wants to take the respiratory rate before one gets into the pen. You can either do that by looking at the movement of the thorax or air movement, condensation in colder weather. You should be looking at the character as well as the rate, trying to assess whether it's dyspneic, tachypneic or hyperneic.
Okay, when we have restrained our sheep, the first thing that we want to do is take its temperature. And what we're aiming to do is not stick the thermometer into some feces, we're aiming to stick it against the rectal wall to get a more true reading. If it's in the middle of a ball of feces, we may end up with an artificially low temperature. Gives you an opportunity to look at the mucous membranes, because quite often they're pink, whereas the mouth may be pigmented. Any sign of discharge, again you check whether there's any diarrhea there. Temperature is normal for signs of respiratory disease, and we're also looking for airflow. Cold days you can obviously see it flow, warm days you may be stuck with some straw, so you can see the straw trembling as it's moving. And again on this side, more convincing on this side. You can smell the breath. That can give you an idea for upper respiratory infections. Sometimes will give you an idea of lower respiratory, but it's much less reliable for that. To have a look at the eyes, we are looking at the 3 conjunctiva in each eye. So we're looking the ventral, dorsal and third eyelid. That's the ventral, so you're pulling the eyelid down, you're pressing in above the orbit. Dorsal, you're lifting the upper eyelid, and the third eyelid, again you're holding ventrally, stretching the eyelid ventrally, lifting dorsally and popping onto the eyeball and out pops the third eyelid. So you're looking for colour, you're looking for discharge, and you're looking for whether the mucous membranes are injected or not.
When we look in the mouth, we're not so interested in capillary refill time. What we're interested with respect to the respiratory system is the colour of the mucous membranes.
You can pinch the trachea to see whether they cough or not. Just doing that by grabbing. And our sheep is not coughing, which is normal. What I next want to auscultate, because I'm on the thorax, is the lung field. Lung field is probably surprisingly small in that it's following the caudal border of the triceps, ventral to the axial muscles, and then more or less triangular. So you're relatively small in most sheep, maybe a wee bit more ventral than that. When you're listening, you should be listening for a reasonable period of time. You should be on 4 or 5 points over each side of the chest. And again on the left hand side, auscultating the lungs, axial muscles, triceps, total border of the triceps, and the line roughly to the point of the shoulder. And less than 3-4 points, it should be 3-4 respiratory cycles per spot. And the final place you should listen to for respiratory noise is the trachea. The advantage of listening at the trachea is that it collects all the noise from the lungs and bundles them up through one place. So it's doing a lot of the work for you. And again, you should be listening for several respiratory cycles.